Next, we're going to go ahead and cover trigger point therapy of the posterior deltoid. The posterior deltoid's origin is right here on the spine of the scapula and also part of the acromion process of the scapula. So it's going to attach on this back side of the shoulder, and its insertion point is down on the deltoid tubercle here. So we're going to fully lengthen that muscle. The posterior deltoid is primarily responsible for external rotation of the shoulder, extension, and abduction away from midline. So we're going to do the exact opposite of that. Kristen, you're going to take your arm, you're going to reach all the way across and grab the top side of that shoulder there. And as you can see, we've now placed this muscle under stretch. She also will take this hand, she'll support the backside of her elbow here, and she can kind of add some additional stretch of her own as we go through the course of this treatment. And then I'm going to work in parallel with the fiber, so I can start all the way down here at the muscle insertion point and work my way up. I like to use a double thumb technique, and I will tell her to push with her opposite arm to kind of exaggerate that stretch. And I work all the way back and up here to the origin site. And then we just continue to work along here. Most of the trigger points I find are right about this area here. So the head of the humerus would be right here. Just inferior to that is where I find most of these trigger points here. And I can use a cross friction technique in this area to intensify the trigger point therapy. Is there anything I'm forgetting?
I don't think so.
Okay. And